Nephrostomy tubes are thin, hollow, flexible tubes with several small holes on the sides. They are inserted into the kidney to help drain urine. The nephrostomy have a drain that empties urine outside the body to a bag. Your tube may have a lock that holds it in place from the inside. Your caregivers will tell you how often you should flush your tube. To flush your tube, you will need a pre-filled 10 milliliter sodium chloride syringe and alcohol pads. If your tube is attached to a drainage bag, begin by untwisting and removing the drainage bag from the tube. Hold the tube up to keep the urine from leaking out of the tube. You may find it easier to place the end of the drainage bag that you just untwisted on a piece of clean gauze to prevent contamination while you flush the tube. Wipe the end of the tube with an alcohol pad. Take the white cap off the pre-filled sodium chloride syringe. Twist the syringe onto the end of the tube. Slowly push the contents of the syringe into the drain. The fluid should enter the tube easily when gentle pressure is applied to the syringe. Remove the syringe by twisting it off the end of the tube. Using a new alcohol pad, wipe the ends of the tube and drainage bag and reattach. Throw away the syringe, do not use it again. Before reattaching the drainage bag to the tube, you will want to empty the bag. Change the drainage bag every month. If you have any discomfort during flushing, you might be flushing too rapidly. Slow the flushing. If you have any of these signs or symptoms, follow these steps.
Okay guys, so as you guys have seen the video on how to flush the nephrostomy tube, I have compiled together a packet of flush kits. So the flush kits itself is gonna have these normal saline sterile solution that you can flush the kits with. Okay, so in each cart, what I'll do is or in the supply room, we'll have these on there. This is similar to the IV flush. So what I did is I just took one of these, and you should only need one of these 10 ml to flush the nephrostomy. After you've disconnected the nephrostomy from the point where this nephrostomy, there's two pieces to it. One, this piece obviously is the drainage bag, right? And then this piece right here connects to it, and then that second piece connects to the actual kidney. So you twist it off, and then the most important thing is obviously infection control. You want to use sterile glove, and the packet that I have is gonna have 3 sterile glove. One for which when you're cleaning them and you're disconnecting it. The other one you can switch again when you're you have to use alcohol to obviously clean it off. But when you're flushing these nephrostomy tubes, make sure this is not a bladder where you're flushing like 60 cc's of fluid. This is connected to your kidney, so literally when you're flushing it, if you encounter resistance, you don't want to be like trying to pump that in as hard as you can. The trick is to really kind of just slowly push these fluids in, this solution in, and 10 ml. It should be the amount that you should be flushing this. Okay, you should see a normal return back of fluids back to the bag, and again, the most important part is the pressure that you're applying to the kidney, and also the amount of solution that you're putting on there. Okay, your bladder can stretch out, and you can flush the bladder with 60 ml or whatever. With the kidney, you're flushing a very specific area that's more sensitive than the bladder, and so again, it's less solution. Okay, so it's 10 ml you're flushing with. Infection control, as I mentioned, is going to be really important, so make sure you're washing your hands beforehand, and you're using alcohol after or before you reconnect back these nephrostomy drainage bag. Okay, so we'll have some of these in the storage room, obviously where things are located in terms of supply goes. And then if you can't find any of the flush kits that I made out, just use the normal IV flush, the normal saline. Okay, 10 ml. All right, guys. Should you have any questions, feel free to ask me. And or if there's something here that you see that you don't like or uncomfortable with, let me know, please. Thanks.